Good evening, everyone. It's so good to have you all here. Today, we are discussing a very important topic, menopause. As we all know, menopause is a natural stage in woman's life when her periods stop, usually in her late 40s or 50s. It marks the end of fertility and brings hormonal shifts that can cause physical and emotional changes. And many women fear these during these times of aging, of losing femininity, of changing relationships, and feeling kind of out of control of their own bodies. So we have amazing panelists today, a very well renowned doctors on this panel to discuss all these changes, all these fears, myths, which usually we find around menopause. So let me introduce our panelists today. The first panelist is Dr. B.R. Kalpana. She's a practicing obstetrician and gynecologist and has the area of interest being high risk pregnancy and infertility. She has been involved in many wellness initiatives which involve youth, women, and children. And she's the faculty member of CREST, which is our research, education, and training center. And she has been involved in various heartfulness initiatives like Family Connect and CME programs. And she has been a very, very passionate heartfulness practitioner since 1999. Our second eminent panelist is Dr. Poornima, who has been practicing Obs and Gynae since 17 years. She is a teaching faculty at Mission Hospital and has performed almost 12,000 deliveries. She is the managing partner of Poornima Hospital, first exclusive women and chair care hospital in Mysuru, which is quite an achievement. And she's a trustee at Usita Bharta Seva Pratishtha Charitable Trust. So we welcome Dr. Poornima also. And our third amazing panelist is Dr. Geeta Bharat, who is also an obstetrician and gynecologist with 15 years of experience in this field. She's been awarded membership of prestigious Royal College of Obstetrics and Gynecologists London, UK in 2008. She acquired diploma in assisted reproductive techniques from Oldenburg University, Germany in 2017. And she underwent hands-on training in assisted reproductive techniques at Kraft, Kerala with Dr. Mohammed Ashraf. So I welcome all three of you. I'm glad you're here.
Thank you so much.
So I'll start with Dr. Kalpana. Dr. Kalpana, what exactly happens in our body during menopause? This is the question which is in all women's mind who are in this age group, physically as well as psychologically.
Thank you, Dr. Urvashi, for the wonderful and encouraging introduction for all of us. And I thank the wellness team. The question was, what happens to the body? Everything lies with the ovaries. That's the main thing we need to understand. And in India, if we see the menopausal age is around 46 to 51. It's a little earlier when compared to the West, where it is about 51 meal. So that is something we need to understand first. So if we are seeing women a little early, then we need to know that they are getting menopausal much early. And the second thing is the ovaries. It is a nature's way of saying go slow. One thing. And second thing is the ovaries, we all know when we are born, we have about 1 million oocytes, and then it comes down to 250 to 400 oocytes by puberty, and then it comes down to even more, to 250 to 2000 1000 or 1500 by the end of 45 to 50 years, and thereby there'll be a change. One is the quality, and second, there'll be changes in the ovaries. The tissue changes. Because of these changes, the change is that they don't ovulate. So the follicular phase becomes less, and we see that their estrogen level starts to go down. There is first thing is there's fluctuation, a lot of fluctuation, and then it goes down and it steadies out. And then the hypothalamic pituitary ovarian axis also changes because of the change in the estrogens and the FSH and LH. You see the FSH has increased so much, and even the LH increases. But the adrenals do give a little bit of estrogens alongside, which can be measured, but it's not to the extent as it is normally. So this is the main thing which causes menopause in a woman. And the pillars for these changes is, one is your physical. In physical, you would see that the nervous system, the bone, the reproductive, the secretory, the endocrine, the cardiovascular, and the musculoskeletal, all are affected. So this is broadly saying that the whole body gets affected when you're menopausal. And then you have the emotional part where you have anxiety, you have irritability, mood swings, and then you have anger issues, stress. That's the emotional part. Then the mental part, you have the stress levels which increase. And the most important thing is the vasomotor changes. I mean, the symptoms which they come with. And that is the most common cause of menopause where the woman tries to reach out for help. And this is seen in about 75 to 80% of the women. So this is one of the important things. And of course, spiritually, you see that there's the external environment which is going on with you. So how much is it that it affects? Whether I'm internally connected or just externally, I'm there without balancing act there. Because as women, if you understand, we are either so involved with the career or we are so involved with the family. So there is no mid path here. So how can we try the mid path? Is that as we go along, we can get the answers. So these are the few changes which happen in the women who are going through menopause. And menopause, again, by definition, is stop flow, a Greek word. So a woman who has ceased to actually have periods for a period of 1 year is a person who has attained menopause, is what we say. So I think with this, I could say that these are the changes. And of course, if you want me to go in detail about each, I could go in, or else we could continue with the next.
So thank you, Dr. Kalpana, for such an elaborate answer, taking us through the whole journey of the emotional, physical, psychological, and the spiritual part of menopause. So I'll get back to you about that for more elaborate answer for that. Right now, can I ask Dr. Poornima, what are the most common fears or myths that women who have around this menopause, and how would we address them?
Good evening, everybody. The main issue, like main fear and all those myths, what are there in the woman's head is like they will be having irregular. Some people will have irregular cycles. So there can be menorrhagia, heavy bleeding will be there. So what they think menopause means, like it will stop abruptly, or it won't have anything, or bleeding will be less or something like that. But everybody won't have that much of, abrupt stoppage. Only 10 to 15% will have abruptly, they will stop getting periods. And some people, they will have menorrhagia. Menorrhagia means heavy bleeding. They will have irregular periods and heavy bleeding will be there. This is the main concern what we see in our OPD patient, OPDs. So they will have heavy menstrual bleeding, irregular periods. They can't assess like when they will have. So many patients comes like we can't calendar wise we can't see, it is irregularly it is coming. We can't just and do puja, and they have to go for any some functions or some traveling plans they can't do because it will be irregular. These are the issues they will have with irregular periods and menorrhagia, heavy bleeding and all those things. And some they are scared of hot flushes. So night sweats they'll and loss of sleep will be there. These are the things. And mood changes, what Dr. Kalpana said, it is mood changes. They will have more fluctuations of mood. And these are the things occurring at the 45, 50 years of age. And during this period, there will be some things, major events will be happening in the family also. So many times they can't cope up with the daughter-in-laws or family members, or some losses in the, so many things will be there in the woman's life. So this is, it corresponds to those events and this age also, menopausal age. So they are not able to cope up if they don't know what is happening inside their body. And this early, it is not because of the environment also aggravates all these symptoms, but still they are not able to cope up. These are the myths, these are the fears they will have, because they will be going through these menopausal symptoms, and lot of family changes, lot of changes will be occurring in the family, and new people will be coming, granddaughters or children will be arriving and those economical problems also will be there. If they are working women, they will have so many other problems because of menopause, hot flushes and mood swings, and they have to cope up. Some we have seen patients, menopausal women who are they don't want any upgradation in their this thing. In the workplace, because some people will get, they are promoted to the managerial post because I don't want these things because I can't cope up. So these are the changes, because they will be seniors in their workplace, but they are not able to cope up all those things because of these menopausal symptoms. These are the fears they will have.
Thank you, Dr. Poornima. You wonderfully explained the anxiety and fears which we all face as we pass through this I think even more than the starting of menstruation, it's the ending of menstruation which creates all those anxieties in us. It is so much responsibility around it. Thank you so much for expressing these fears so openly. Now I'll come to Dr. Geeta, and I just want to ask her, what are the menstrual irregularities or symptoms which women of this age should not ignore as they approach menopause? Kindly unmute yourself.
Namaste, everyone. Thank you, Urvashi for asking that important question, because many women tend to dismiss menstrual changes around their 40s as just age related. But not every irregularity is normal, and knowing when to seek help can make all the difference during menopause. So, as women approach menopause, cycles may naturally become irregular, lighter, heavier, or more spaced out because of the fluctuating hormones. However, there are certain red flag symptoms that should not be ignored. So usually the heavy and prolonged bleeding, that is if the bleeding is more than 7 days, or if the woman is soaking more pads every hour or two, or passing large clots, it could indicate fibroids, polyps, thyroid issues, or any precancerous changes. So second abnormal bleeding pattern we see is bleeding between the periods. Usually the periods are spaced out. They can get delayed periods, once in 2 months, 3 months, and once in 3 months, and they may bleed little heavily. This is quite a normal pattern. But bleeding in between the periods or after a sexual intercourse is very alarming, and they have to seek help even it is a little bleeding when they don't expect that period. And by definition, menopause is one complete year. If they fail to have any cycle in 1 year, then it is supposed to have reached their menopausal state, and after that they should not bleed anytime. So any bleeding, even if it is very little, after 1 year of amenorrhea or period free period, bleeding free period, we take it seriously and we define it as postmenopausal bleeding. So if the woman is amenorrheic for 1 whole year, and then even if she has very little bleeding, she has to seek medical help, because there can be some abnormalities like endometrial carcinoma or cervical cancer, etc. So very frequent and erratic cycles. Usually they think that bleeding heavily is good for health, all the dirt is going out. This is the myth that many women carry with them. And usually if they bleed a lot, they will end up having severe anemia and health issues. So better they seek advice at that time. And accompanying symptoms are also important, not only bleeding irregularities. If it is associated with severe pelvic pain, bloating, or sudden weight loss, it may indicate some malignant pathology in the ovaries or the endometrium. So it's more of awareness rather than fear. So they should know when to seek help from the doctor. And probably being aware of the irregularities during period and seeking correct time the help from the medical fraternity should go a long way for them to enter the menopausal stage with confidence. And that can go a long way in preventing further complications.
Thank you, Dr. Geeta. That was quite an illuminating answer, because we sometimes think just menopause is all about the stoppage of bleeding and we forget about it. And we never think that post menopause, after a year, if bleeding is there, we need to consult someone. Or we have excess bleeding that we need to consult. We take everything so lightly. We are so busy with everything, grandchildren, children, everything around. Thank you so much for making these things more clear for us. Thank you. I'll come back to Dr. Kalpana. And her spiritual advice is so calming also. So please add that also. So I want to ask, how does the holistic lifestyle approach, including sleep, stress management, and self-care, support women through this menopausal phase?
It's surprising if you understand, most of the Indian women do not understand menopause. There's no awareness, first thing. And second thing, they do not approach for help thinking things are normal, like how they've explained. This myth should actually go away, and awareness has to come in. For that, we need to do a lot of work, of course. And second thing is, am I understanding my body well? Am I respecting my body? Is something we do not do as women. If you just see, we are just so spaced out, like all of us just said, we have our grandchildren coming, we have that function, we have so many things happening. But what about myself? That is something we do not actually really think. And then that's something we need to make the clients or the patients who come to us aware, that you have to give yourself that amount of time to understand your body and see what it needs. This is where most of the things come. In fact, most of the menopausal symptoms go away with this thought itself, if you see naturally. And the other thing is the physical, like you said, the sleep and the hot flushes and things like that, all the physiological changes, they can be addressed, provided am I able to take it, and am I able to bring in that change in myself? Am I able to transform myself into something where I can accept this? And let going is very important, because we have talked about the relationships, we have talked about how everything goes on. So letting go of things, am I able to do it, is something we need to understand. That is very difficult to give, because Like you have your children coming, you have your grandchildren coming, then you have your functions, then you have something else to do. But what am I doing for myself is the question. And also, if possible, if we can develop some hobbies which we have let go on while we were taking care of during the family or our profession, if we can actually go back to it, because learning, there is no end. We can always keep learning and also improve in our learning. And it helps our cognitive development, because as we are aging, we know even the central nervous system has estrogen receptors. So even that could help us a bit. And then meditation, of course, because I was just reading that the cells, the ovarian cells, I mean, they have a shorter telomere length. The telomere length comes down. So if I'm meditating, is it going to help me? Is it going to increase the telomere length? Is something we can think of and meditate more and see what happens. So that could be a place where we can just look into. And the main thing is, am I able to come across all the other relationships? Am I able to actually go along with everybody without irritability, without anger, going to the root of the problem rather than just spurting out? So that's where our resilience, and that's where our pausing, what we learn in our day-to-day heartfulness meditation comes in. So that could really help us in doing all this and changing our thoughts, making it a positive rather than a negative, saying, yes, this is what it is. I am aging. I have to accept it. And this is what it is. Of course, whenever needed, going to the doctor becomes very important, because we cannot actually ignore certain things, like how Dr. Geeta said, certain things are pathological. So we do need that help. So apart from that, the physiological part, am I able to challenge it out and overcome all these, is something we can look at. And of course, Heartfulness Way has always helped us. So doing meditation definitely helps. Yes.
One thing I want to add with what Dr. Kalpana said, in Heartfulness, we have got Restart one program. They have it is their program. They have chatted on program. It's very good. Restart. Even my mother and my mother-in-law joined.
Yes, they have
Restart.
started. And even Brighter Minds, they have started for elderly.
Yeah, Brighter Minds people only, they have started
Restart. So that really helps our
more than 50 years.
Yes,
40,
yes.
It is good actually. So
Yes.
those who are interested, they can join that program, through Heartfulness.
And the stress, of course, we all know how we can combat it. We know that we have to meditate. We have to bring in the transformation or the changes in ourselves and try to develop resilience, like told earlier. So stress can be managed, and we have stress detox, so we can use that. And then for sleep, of course, sleep is another problem where we see in menopausal women. So this, we have a sleep detox and a sleep relaxation technique which we could use. And the screen time, of course, should be taken care of with all the women, because most of us are with mobile through and through, especially when you don't have any work. So keeping occupied is the main important thing, rather than letting thoughts go everywhere. Yeah. Thank you so much. Yeah.
Thank you, Dr. Kalpana, for such a holistic view of the whole journey. Because we somehow become stuck in the physical part of it and don't understand how to ease into menopause, how to gently accept everything. Thank you for such a wonderful answer. I'll come back to Dr. Poornima. Dr. Poornima, I want to ask, what should women know about hormone replacement therapy, HRT, its benefits and its risks?
See, hormone replacement therapy is because what all symptoms we are facing during menopause, it's because of estrogen and progesterone. Estrogen will be depleting and progesterone also will be depleting, and there will be low level of estrogen and progesterone in our body. That's why they are facing all those things, because estrogen is needed for our skin and as well as for the bone strength also. So once the estrogen depletion starts, the lady will have this osteoporosis. This is the main what we were concerned, because osteoporosis and basic metabolic rate will come down and they will put on weight. Because of that, again, because of osteoporosis, they are more prone for fractures and all those things. So with these things can be tackled, because nowadays our lifespan has been increasing and we have to do so many work menopausal, even though menopause means like they have got more activity, I mean more work to do. There are more responsibility will be there. So they have to be more strength should be there physically as well as mentally. So for physical strength, for bone health, we have, this is HRT it's very helpful. HRT means it is cautiously we have to use. They have to consult the gynecologist. We will check their scanning report. I mean, endometrial thickness, we have to see whether they are having any other abnormalities or precancerous conditions. With that, it can be safely used. And along with HRT, we have to supplement with calcium, magnesium, which is needed for the, also vitamin D3. So these things has to be supplemented. Along with that, we also advise them to go for the bone strengthening exercises like weight bearing, weight strengthening also there, and muscle strengthening. So most of the time, because of menopause, the protein intake will be less and also muscle loss will be there. So they think like just doing walking and some yoga, it will help. No. Actually, to have the strength, they have to do the muscle strength exercises, and for bones also flexibility should be there. They have to do some exercises which will improve their muscle strength as well as bone strength. So for these things, HRT definitely it will help. And once they are on HRT, they have to be on regular checkups, and at least once in 6 months or once in a year, they have to do the regular scanning reports. And if they have any bleeding or spotting or something like that, they have to be investigated.
Thank you, Dr. Poornima, for such a wonderful answer. And yes, we see all females in their 50s just walking around the society and never thinking of any weight training or a strength training, which is so very important. And thank you for bringing that important point forward. I'll come back to Dr. Geeta now. Dr. Geeta, how can we effectively sensitize the family members and the people around us about menopause and its emotional, physical, and social aspects?
Thank you, Urvashi, for that beautiful and very relevant questions, actually. Menopause is often described as the change, but I would like to call it a powerful transition. It's a time when a woman's body, mind, and emotions are recalibrating. But unfortunately, when she often faces in the family is a silence or a misunderstanding, even within her own home. So, how do we address this problem? So, how to sensitize the family members? I believe it begins with the conversation, compassion, and correct information. And let us start by open conversation with the family members. For too long, menopause has been a taboo, like it is whispered around, not usually openly discussed in the families. But we have to start discussing it as a normal health discussion, like pregnancy, like adolescence. We have to start discussing about menopause. When we speak about it openly, we take away the shame or replace it with understanding. And we have to not only educate the family members, not just sympathize, but have a real information with them. Simple awareness makes a huge difference. Husbands, children, and even in-laws should be understanding that hot flushes, irritability, sleeplessness, or fatigue are hormonal, and they are not an intentional behavior, which usually causes a lot of conflict in the family. That women start showing these symptoms intentionally, then all the problems start. And once they are aware that they are, they are unavoidable part of this change that the body undergoes, then the empathy naturally flows. That is what I feel. And emotional sensitivity is the key. This is the time when a woman needs emotional cushioning, husband's patience, and a child's understanding, or a parent's support that can make her feel seen and heard. Just a simple, I understand you are having a tough day, can be more healing than any medicine. So we have to make the family aware of these things. Bring family into the consultation room. Whenever a menopausal symptom woman usually comes with her problems, we doctors have to make it a point to talk to the attenders. Either husband or children have to come inside, and we have to explain to them rather than giving her some solution, and why these problems are occurring, what is the physiology behind it, and how best they can cope up, help her cope up with these symptoms. We have to educate them rather than just giving some medication. And we have to make it a shared lifestyle journey, because once we advise some, you eat that, you eat this, you do some yoga, meditation, mindfulness, and you go for exercise. If we tell only the woman, it will never happen, because she is singled out. Probably she doesn't have a time enough to her for herself to schedule all these things. So it is important that a group behavior at the home is encouraged. Like we have to ask her husband or children to take her for a walk and do a common yoga session, and mindful eating together with the family. These things can go a long way. And when a woman going through the menopause feels understood, respected, and supported, she doesn't just survive this phase, she thrives. And when she thrives, the whole family grows emotionally stronger. So the family members have to be made aware of and educated about these changes. Then probably we are helping her go through these changes very easily. So it
Thank you.
cannot be stressed enough that family plays a very important role.
Yeah, that's absolutely true. Thank you, Dr. Geeta, for such a beautiful answer. Because around our 50s, we are supposed to be most adjusted, most
And
quiet, most
one more point I
non-emotional.
just want to add, because now we are seeing a lot of nuclear families. Even if we educate the husband and the children, children are staying somewhere abroad in America, London. They are not with the parents most of the time. In that case, peer groups, they have to have their own age group people around, and they do some collective activities either in the apartments or clubs, and getting involved, as madam said, getting involved and not sitting idly is very, very important. Their nutrition has to be taken care of, their physical activities has to be taken care of. And usually in Japan there is a village, ikigai, you might have all known. Yeah, because they have to find some purpose in their life. So then the menopause can be a new beginning, and they can find some other meaning in life, and they start their second innings.
Yeah, that was
It's
a
not
beautiful
the
addition.
end.
Sorry. Please. Yeah, it's not the end. It is a beginning. And I mean, from shame to understanding,
Yeah.
from feeling it as an ending to starting afresh. You
Probably a
have,
woman is at a very right time and the right stage in life, because all her responsibilities are over, children are settled, and she doesn't have to do much for anybody else, and it is the time to focus on herself, her passions, her left out dreams, so she can pursue that and start a new beginning. So to do that, she needs some right support and right encouragement at right time. So that is what we need to do as a society to bring about the potential in our women.
that are beautiful, motivating words. I almost feel like restarting my whole artistry career now. Thank you.
It's never late. It's never late.
Yes.
Agreed, Dr. Kalpana. And your this beautiful wise presence is so calming.
यही समय है, सही समय है, मोदी in Modi ji's world.
Exactly. So, a common question to all speakers. If you have to summarize thriving through menopause in one key message, what would that be? I'll start with Dr. Kalpana.
Okay, to continue with what Dr. Geeta was saying, I need to be heard is something we should make the client understand, that even if you have the people around you, the family, but you need to hear me is something they should understand. So hearing me is very important. Otherwise, they will just again put you in a corner, and as usual, things go on. The second thing is this is not just a gynecologist involvement here, because you're talking about dietitian, you're talking about a physiotherapist, you're talking about a psychiatrist or a psychologist. When you have anybody coming with an issue, so it's a team effort, not just one person's effort. So this is something I would like to bring about. And the third thing is I can thrive this through because this is the nature's way of doing things. And it is a natural stuff which is happening. So if I can understand that and thrive through this, I can go past and have a new beginning is what I would like to end it with.
So what I suggest is not to get scared of aging. So age gracefully and be confident, and people are there to help definitely, and they should be confidence enough should be there, like, and regular checkups should be there. So regularly they should go for a checkup and talk it out whatever the problems are there. So they should have gynecologist or a family physician who she can go and discuss what is happening with her. So confidence and be positive. Positivity is very important in this age group.
Thank you. Dr. Geeta, please.
Yeah, to tell it in one key message, menopause is not an ending. It is just a pause and start a new beginning. It is a transition to a new phase of vitality, balance, and self awareness. And with the right knowledge and support and lifestyle changes, women can embrace it with confidence, health, and joy. So, I mean, as medical fraternity, we have to give that right environment for the women to, thrive through this stage, and then menopause becomes a beautiful beginning.
Thank you, Dr. Geeta, for that pep talk. It is very encouraging.
I had written that last sentence actually.
Wow. Beautiful. So this was such an amazing discussion. I am an ophthalmologist, but today I knew so many new things about menopause. And I'm sure our audiences will enjoy this talk, enjoy this discussion as much as I have. So thank you so much, Dr. Kalpana, for your beautiful presence, your aura, and your wisdom. Dr. Poornima, for you're full of life. I loved your discussion with you. And Dr. Geeta, for your inspirational, what do you call those one-liners. So I thank you all for this wonderful discussion. And if you want to add something, the floor is yours. If any one of you wants to add something before we end this.
Actually, October we have a World Menopause Day, and probably
Yes.
that is why you have conducted this webinar. And at least once in a year, we think about menopause, its problems, and how we can solve that, what support these women have. So you are doing a great job, and I thank Heartfulness for arranging this webinar and making many women know about menopause. And definitely, I'm sure it's going to help many of them. Thank you.
Thank you. So thank you all of you. And I hope this journey continues with all of you. Thank you.
Thank you.
And good night.
Thank
Good
you.
night.